New studies agree that animals sold at Wuhan market are most likely what started the COVID-19 pandemic. CNN. In June, the World Health Organization recommended that scientists continue to research all possible origins of the COVID-19 pandemic, including a lab leak. Two newly published studies take totally different approaches but arrive at the same conclusion. Huanan Seafood Market in Wuhan, China was most likely the epicenter for the coronavirus. The studies were posted online as preprint in February but have now undergone peer review and were published Tuesday in the journal Science. In one, scientists from around the world used mapping tools and social media reports to do a spatial and environmental analysis. They suggest that although the exact circumstances remains obscure, the virus was probably present in the live animals sold at the market in late 2019. The animals were held close together have and could easily have exchanged germs. However, the study does not determine which animals may have been sick. The researchers determined that the earliest COVID-19 cases were centered at the market among vendors who sold these live animals or people who shopped there. They believed that they were two separate viruses circulating in the animals that spilled over into people. All eight COVID-19 cases detected prior to 20 December were from the western side of the market, where mammal species were also sold, the study says. The proximity to five stores that sold live or recently butchered animals was predictive of human cases. The clustering is very specific. Study co-author Christine Anderson, a professor in the Department of Immunology and Microbiology at Scrip Research, said Tuesday. The extraordinary pattern that emerged from mapping these cases was very clear, said another co-author, Michael Worobey, department head of ecology and environment evolutionary biology at the University of Arizona. The researchers mapped the earliest cases that had no connection to the market, Worobey noted, and those people lived or walked in close proximity to the market. This is an indication that virus started spreading in people who worked at the market, but then started as spread into the surrounding local community as vendors went into local shops, infected people who worked in those shops, Worobey said. The other study takes a molecular approach and aims to determine when the first of coronavirus infections crossed from animals to humans. The earliest version of the coronavirus, this research shows the probably came in different forms that the scientists called A and B. The lineages were the result of at least two cross-species transmission events into humans. The researchers suggest that the first animal-to-human transmission probably happened around November 18, 2019, and it came from lineage B. They found the lineage B type only in people who had a direct connection to Huanan market. The authors believe that the lineage A was introduced into humans from the animal within weeks or even days of the infection from lineage B. Lineage A was found in samples from humans who lived or stayed close to the market. These findings indicate that it's unlikely that SARS-CoV-2 circulated widely in humans prior to November 2019 and defined a narrow window between when SARS-CoV-2 first jumped into humans and when the first cases of COVID-19 were reported, the study says. As with other coronaviruses, SARS-CoV-2 emergence likely resulted from the multiple genetic event. The likelihood that such a virus would emerge from two different events is low, acknowledged the co-author Joel Weltham, an associate adjunct professor of medicine at the University of California, San Diego. Now I realize that it sounds like I just said that at once in a generation event happened twice in short succession, and the pandemics are indeed rare. But once all the conditions are in the place, there is a genetic virus capable of both human infection and human transmission that is in close proximity to humans, the barriers to spill over have been lowered such that in multiple introductions we believe they should actually be expected. Raytheon said. Anderson said the studies don't definitely disprove the lab leak theory, but are extremely persuasive. So much so that he changed his mind about the virus origins. I was quite convinced of a lab leak myself until we dove into this very carefully and look at it much closer, Anderson said. Based on the data and analysis I've done over the last decade in many other viruses, I've convinced myself that actually the data pointed to this particular market. Waroway said he too thought the leak was possible, but the epidemiological pre- preponderance of cases linked to the market is not a mirage. This it's a real thing, he said. It's it's just not plausible that this virus was introduced any other way than through the wildlife trade. To reduce the chances of future pandemics, the researchers hope they can determine exactly what animal may have first become infected and how. The low ingredients for the genetic virus with pandemic potential are still lurking in the wild, Wortham said. He believes the world needs to do a much better job doing surveillance and monitoring animals and other potential threats to human health. Anderson said that although we can't prevent outbreaks, collaboration between the world's scientists could be a key to differences between a disease with a small impact and the one that kills millions. The big question we need to ask ourselves is the next time this happens, because it will happen, how do we go from detecting that outbreak early and preventing that outbreak so it doesn't become a pandemic?